Broughan and Deputy Collins to conclude.
So I'd like to commend, first of all, my colleague, Deputy Joan Collins, for her tremendous work in bringing forward this motion on the local drugs and alcohol task forces, and a motion, of course, which very strongly supports the work of the task forces, which is central, I think, to the implementation of the 2017 Reducing Harm, Supporting Recovery strategy. And of course, we're calling in the motion on the Government to implement the commitment in the programme for Government to allocate an Emerging Needs Fund, to commit to urgent implementation of the Public Health Act 2018, to accelerate the work of the Garda Asset Profilers, to ensure a partnership approach to the new youth scheme, and to conclude the HSE review, among some other measures. And also the Fianna Fáil and Sinn Féin amendments, of course, are very welcome. Of course, there are 14 local drug and alcohol task forces, Ceann Comhairle, 12 in the Dublin area, 1 in Bray, 1 in Cork City, and 10 regional drug and alcohol task forces. And I'm informed that current funding, of course, is down around 37%. That's an astonishing cut, Minister, since the 2008 period. And there were a number of years, of course, with no funding restorations whatsoever since. And in Budget 2018, I noticed HSE received an additional 6.5 million for addiction services, but none of this seems to have been distributed among the task forces. And as we know, tragically, I think the last numbers to hand, there were almost 700 drug-related deaths in 2015. It continues to be a scourge of our communities and our families. I do welcome some of the measures that the Minister for Health and yourself have said that they're interested in bringing forward. Some of the strategic actions, of course, of the task forces include responding to the needs of women and older people with substance misuse issues, supporting and promoting community participation in all local, regional and national structures, and promoting the participation of service users and their families. But, Minister, how can the task forces be expected to deliver on such actions with inadequate funding and an erosion of morale, partially due, I think, to the HSE review, and a review which is, I understand, has been completed, but with little or no consultation from with the task forces to the terms of reference of this review? And how can the HSE expect to review the remit and running of task forces when so much of the work, of course, and interaction of those bodies falls outside the health sphere? I mean, constituents who work and volunteer in the sector, they inform me they strongly agree with transparent systems in place to report on the spending and allocation of task forces funding, but they make a convincing case that core funding to community and voluntary groups should be significantly increased. I'm informed, for example, that some of the organisations can't pay yearly increments to their experienced professional core staff, and I'm informed also of the importance, as you well know, Minister, and we all know in this House, the importance of community employment schemes for assisting people in addiction back to the workforce. But you know, you have term limits on those schemes, and that can also make recovery very, very difficult. And organisations and volunteers working with people with drug and or alcohol addiction also mentioned deficiencies with the health service, the psychiatric services, dual diagnosis service and so on. One of the key organisations in my own constituency, Kilbarry Coast Community Programme, state, for example, and I quote, "The increasing number of drug deaths each year is a result of frontline services not being put in place or being totally overwhelmed," end quote. And my own constituency of Dublin Bay North, I'm very well aware, of course, as I think you are also, Minister, of the excellent work of the Kilbarry Coast Community Programme, which I mentioned, the Dáil Centre in Darndale, another outstanding local service, the RASP, the Laneview Learning Centre in Coolock, the EDIT, the Edenmore Drug Intervention Team, and indeed several other important anti-drug and alcohol organisations in various parishes in the North East. One aspect, I think, which the Minister referred to, and which I'd also like to briefly mention, of course, is the whole area of drug-related intimidation. I think you may have seen, Ceann, how our parliamentary colleagues, if you like, in Westminster are very agitated at the moment with a huge level of homicides from knife crime, but we have an outrageous level, I think you'll agree, Minister, of homicides from gun crime and from some of the issues that are created out of what's been happening in the drug abuse area. And I mean, this is the growing and worrying part of the drugs trade and addiction. It's terrorising simply communities around our country. And I noticed that in 2016, Citywide undertook a survey which showed that under 10% of people reported their experiences of intimidation to An Garda Síochána, and the Garda figures back that up. with just one case, I think, under investigation in 2017, and I know you referred to the Garda asset profilers, but there's a real issue here about communities living in terror, living in fear, Minister, and I hope that that's been taken on board by yourself and the Minister for Justice as well, and the Minister for Health. So finally, I want to warmly commend the work of the Drug and Alcohol Task Forces and to the organisations and projects that are funded by them around the country, and to congratulate my colleague, Deputy Collins, for bringing forward the motion. Thanks, Ken.